And now we have in our community,
They're recording. That's all.
oh,
Go
but she
ahead.
has a sign up here. Got it. When I came out here in 69, there was only Blue Jays. Now we have Uncle Giuseppe's, we have Stop and Shop, we have Key Foods, and there were no fast food places. Now we have McDonald's and Burger King's. There was only one pizza place in all of Smithtown. We're eating larger portions, we're eating high calorie foods, lots of sugar, and we're leading a sedentary life. You're watching too much TV, your jobs are sitting in front of a computer, and when you're home, the TV is on or your computer is on and you're playing computer games. Now, what you all should do is go on your iPhone or laptop and figure out what your body mass index is. You put in your weight in pounds and your height in inches, and it transforms your weight into kilograms divided your height in inches to meters square. If your BMI is 18.5 to 24.9, you have a normal weight. If it's 25 to 29.9, you're overweight. And if your BMI is 30 or higher, you are obese. Now, obesity is an epidemic. More than 70% of men and women in America are overweight or obese, and it's a preventable cause of death. When we look at various races, in women, African American women, about 56% are obese. In Latino women, about 43% are obese. And in Caucasian or white women, about 39% are obese. And this obesity and overweightness is associated with type 2 diabetes, hypertension, heart disease, stroke, and all types of cancer. But it is a preventable cause of death. Now, the causes of obesity and overweightness is you're taking in too much food and not burning enough food. Genetic causes are rare, less than 5 or 10%. Years ago, people would say, well, I'm overweight because I have a gene problem. That's not so. You're taking in too much food and not burning enough energy. Now, what controls our appetite are the following. When we eat food, our fat cells in our body, in our adipose tissue, release a hormone called leptin. It goes into our bloodstream, it goes to our brain, to our center in the brain that controls our appetite, and it says to this center, I'm full, I had enough, and we stop eating. What happens if you're overweight or obese? You produce so much leptin, it goes to your brain receptors in your area of your brain. It becomes desensitized to the leptin, so you lose that sense of being full. Here's a young man or a young woman measuring their waist. When we eat food, our food is composed of three things. It's composed of carbohydrates, proteins, and fats. And digestion is mechanical and by enzyme. Mechanical meaning I chew the food and I make the particles smaller. Enzymes are produced in your stomach, your small intestine, in your salivary glands, and in your pancreas, and it breaks it into small particles that are absorbed and go into your body. Your carbohydrates are broken down to simple sugars. Every cell in your body needs this simple sugar called glucose for energy. And what pushes this energy, glucose, into each of your cells and organs is something that the pancreas may call insulin. If you eat too much carbohydrates, they go to your liver, the liver transforms them into free fatty acids that go to your fat cells and they're stored as triglycerides. So your fat cells get bigger, they grow bigger, They multiply, you gain weight. But at a certain point, what happens is that the fat cells can't hold all this bad cholesterol and it shoots it into your circulation and your lipids go up. Now, the location of obesity is so important. You should measure your waist. If you're a lady and your waist size is 35 inches or more, you have central obesity. If you're a man and your waist size is 40 inches or more, you have central obesity. Now, fat cells are not something that just lies there, they're metabolically active. They produce an inflammatory substances. So you're living with a low grade systemic infection. That's why people who are obese did terribly when they got COVID. They already had a low grade systemic infection add to COVID, and many people died who were obese. And what happens with this low grade inflammatory problem that you have when you're obese from these substances is you need more insulin to push the glucose into your cells. And eventually, your pancreas gives out and you develop type 2 diabetes. These cells that are filled with this bad cholesterol, when they release it into your circulation, your cholesterol and lipids go up. It has an effect on your blood vessels. You develop hypertension, heart disease, stroke, and these cells also, these fat cells make an enzyme that transforms the male hormone you men make and you female make into estrogen. And this estrogen causes cancer in men and in women. Now, this is a young lady, but it could be a young man if we cut off the ponytail in the back. Obviously, this person is obese, and the blue is the skin. And you see skin and going from right to left at her abdominal area. You see skin, the blue, and then the subcutaneous fat. That's the fat you pinch an inch. And underneath that is pink. That's your abdominal wall. And underneath that is the fat inside your body,
I'm
inside
sorry,
your
doctor, we
abdominal
can't
cavity.
see the slides.
Pardon?
The slides aren't showing.
Okay, we'll check that.
Okay, let me see here. Are we still sharing the screen or no?
Yes, you should be.
Your screen's paused. We paused it. So we want to unpause this. How do we unpause the screen share? Yeah. All right, hold on. We're going to stop sharing and then share again. Hold on
Okay.
and see if that works. Okay. All right. Is it sharing now?
Now I see the screen.
That's
Oh,
better.
okay. All right. There you go. Right.
Okay, you can see the screen now, correct? Hello?
Yes.
Yes, we
Yes.
can.
Here we have a person, it could be a man or a woman, and looking from right to left, the blue is the skin. Underneath the skin is yellow, that's subcutaneous fat. And the pink would be the abdominal muscles, and inside is the fat that covers your internal organs. That's called visceral fat. Now, what happens with this chronic inflammation, there's an increase in insulin resistance. The pancreas burns out, you develop type 2 diabetes. The fatty tissue around your kidneys causes high blood pressure. The fatty tissue around your throat causes sleep apnea. Because of all the weight you're carrying, you develop osteoarthritis. An increase of this fat in your abdominal cavity causes GERD. And when the fat cells get so full, they release this bad cholesterol. You develop problems with your arteries, you develop cardiovascular disease. And because the fat cells have an enzyme that converts male hormone to female hormone, you men and women will develop cancer. And these are the cancers that men and women develop. You develop thyroid cancer, kidney cancer, liver cancer, gallbladder cancer, meningioma, gastric cancer, and pancreatic cancer. And in women, what you will develop is breast cancer, endometrial cancer, that's cancer of the uterus, colorectal cancer, and ovarian cancer. And you men will develop pancreatic cancer. Now, here's a young lady. I hope there are young ladies watching this program. She's obviously overweight or obese. Now, she has problems. The reason why she has problems, she is in a chronic state of low-grade inflammation because her fat cells are excreting inflammatory substance. And then two, she has a high level of estrogen, which is affecting her ovaries. Both the inflammatory substances and the high levels of estrogen are affecting her ovaries. So she has menstrual abnormalities. She's not ovulating. She has infertility, and her pregnancy rates are very, very low. What I used to do in my practice when I practiced OB, before I would allow or recommend a woman became pregnant if they were overweight or obese, we would have a pre-pregnancy consultation, and we would put them on a 12 to 1500 calorie diet and an exercise program to have them lose weight before they became pregnant. Now, what happens? Many of these ladies go for in vitro fertilization. If those of you have gone, it's very, very expensive. These people who are obese or overweight have smaller eggs. They have smaller, decreased fertilized eggs. They have impaired embryo implantation. The quality of the embryos are poor, and they have a lower success rate. What happens to these people when they become pregnant, these obese people, is they have an increase in miscarriages. They develop toxemia more frequently. They have premature delivery. They develop gestational diabetes. They have larger babies, some of them. They have a higher cesarean section rate. What happens to the babies when they're born? Some of them develop open spine or neural tubal defects. They can develop cleft palate or cleft lip, and some of them have cardiovascular abnormalities. So it's so important, you ladies, young ladies out there, before you become pregnant, make sure your obstetrician does a pre-pregnancy consultation, talks to you about a proper diet and exercise program. Because if you do that and lose weight, your success rate in pregnancy, becoming pregnant and carrying the pregnancy, will be better. Now, here we have a menopausal lady. For you men and women, it could be a man over age 50. What is so important for us is our basal metabolic rate. What that means is how many calories does Dr. Benura burn when he's at rest? Now, what burns calories, my calories for a man, is my lean muscle mass. In you ladies out there, it's estrogen. And in menopause, you're making no estrogen. So this menopausal lady's basal metabolic rate is lower. And if you fellows and you ladies out there don't exercise, you will lose 1 pound of lean muscle mass, you adults, every year. So when you lose lean muscle mass, your basal metabolic rate also decreases. And if you lose muscle mass, you develop muscle weakness, and then you're too weak to exercise. So it's a double sword in this lady. And 40% of you ladies who are menopausal are obese. So you have to do something about it. Menopausal women who are obese develop type 2 diabetes, cardiovascular disease, vitamin D deficiency, because Vitamin D is stored in your fatty tissue. Obesity, fatty tissue is an insulator. You will develop hot flashes and you have a high risk of developing cancer of the breast, cancer of the lining of uterus, ovarian cancer, and gastrointestinal or colorectal cancer. Now, what is the therapy? We discussed the causes of obesity, how we diagnose obesity. Now let's talk about what the therapy of obesity is. One therapy is diet and exercise, and you can lose 5 to 10% of your body weight in a year. The other is medication, the other is surgery. Now, let's talk about diets. One diet, or there are two types of intermittent fasting diet. One type of diet I call the feast and famine diet. One day you eat whatever you want to eat. The next day you only eat 500 calories for either lunch or dinner. And you will lose weight. But the problem with this diet, you're hungry with this diet, and it can cause you to be very angry and very upset the days that you're hungry. Another diet that seems to work, and a lot of men and women are on, is you can eat whatever you wish between 10 a.m. and 6 p.m., but from 6 p.m. to 10 a.m., all you can have is liquids that have no sugar, no calories. It could be a seltzer or it can be a water that you drink. Diets alone do not work. With diets, we're going to get to that. The next thing, the diet that I am on and the American Heart Association recommends is the Mediterranean diet. That's a 12 to 1500 calorie diet in which you eat every day fruits, vegetables, nuts, beans, lean animal protein, fish, and low-fat dairy. Low-fat dairy. It is so important that if you are obese, if your BMI is 30 or more, it's difficult to do this alone. You should join. To change your lifestyle and behavior, you must join a weight reduction program. One of the best ones locally in Suffolk and Long Island would be Weight Watchers. I looked it up on my computer this week. I think it's $10 or $12 a month. What you do is they check your weight weekly. They check your blood pressure weekly. They check your food list that you ate, and they check your exercise every week. It's so important that you join a weight loss program. Another one would be Jenny Gray. It's very difficult to do this alone. And with weight, you must exercise. A diet alone does not work. Even the diet I'm on, the Mediterranean diet, it doesn't work alone. I exercise. And you should be doing a minimum of 150 minutes a week of exercise. And that would be brisk walking. And you should do also muscle strengthening exercises because your lean muscle mass burns calories. And the more lean muscle mass you have, the higher your basal metabolic rate. You'll be burning more calories at rest. And the exercises can be walking on a treadmill. It can be lifting weights 20 minutes, 3 days a week, but no more than 3 pounds, ladies. Because what we've seen in menopause, from lack of estrogen, there is a high incidence of rotator cuff injuries. So go to one of these stores that sells health equipment in the mall, in your malls, and buy 2 to 3 pound weights. What I do is I spin and I lift weights. I try to spin and lift weights 3 times a week, and I play tennis once or twice a week. And during my office hours, sometimes and on Tuesday, when I'm seeing people with consults or ultrasounds, I keep 4 pounds weights in my office and I work out for 20 minutes. Now, let's talk about weight loss medication. There are multiple weight loss medications, but before you go on a weight loss medication, they're expensive and some of them have side effects. Try a diet, try an exercise program, sign up for a weight loss program before you try a medication. And the medications are the ones that I listed in Xanacal. These are all oral medications. Xanacal is offered over the counter. You don't need a prescription for it. How they work, some work in your brain, in the center of appetite, and says, I'm full. The others block the absorption of fat. Now, on the bottom in big letters, I wrote Wegovy. That seems to be the medication that many people are looking to take if their BMI, and you only take medications for overweightness if your BMI is 30 or more, or your BMI is 27 to 30, and you have sleep apnea, high cholesterol, hypertension, or type 2 diabetes. Now, Wegovy is an injection. There are three drugs for weight loss that are approved by the FDA. One is Wegovy, one is Zepbound, and the other is, I forget the name, Saxander. So there are three drugs. The one that I would use in my practice is Wegovy. Now, Wegovy, you see on the upper left side, that tube, that's an auto injector. Now, the study, and what it is a glucagon like peptide 1 agonist. It acts on the center of your brain. It's a weekly injection that you give yourself. The needle is tiny, it's like a diabetic needle. And it's a weekly injection that you take every week. Now, there was a study of almost 2,000 men and women from age 18 to 70 who used weekly Wegovy. And after 68 weeks, the majority lost 15% of their body weight, and 1 out of 3 lost 20% of their body weight. And Wegovy was used with a low calorie, low fat diet and an exercise program. The side effects of Wegovy are nausea, vomiting, and diarrhea. But on this study of 2,000 men and women, only about 5% dropped out because the symptoms were mild. The only contraindications to Wegovy are if you or your family had a history of medullary cancer of your thyroid, or if you have pheochromocytoma or primary hyperparathyroidism. This year, Eli Lilly, you see those blue pills, is coming out with another oral glucagon-like peptide agonist, one that acts on your brain. And their studies show that after 26 weeks, their people with a diet and exercise program have lost 10%. The problem with the injectables is many insurance companies don't cover them, but many insurance companies, like commercial insurance companies, will cover them. And the copays are not very, very high. But none of these drugs, either oral drugs or injectables, work without exercise and diet. For those people who have a BMI of 40 or higher, or 35 or higher, and comorbidities, type 2 diabetes, hypertension, sleep apnea, there's weight loss surgery. And the one that seems to be most popular now is the sleeve gastrectomy. And what a sleeve gastrectomy is, your gastric surgeon removes 70 to 80% of your stomach. So you have a smaller area to absorb food. But even if you have sleeve gastrectomy, you will regain the weight unless you follow a strict diet and exercise. And the side effects to a sleeve gastrectomy is that you don't absorb enough calcium and vitamin D. And what we recommend is that you take adequate calcium, adequate vitamin D, and you have a bone density. Now, I've been lecturing since 1978 in the medical school and to women's groups and men's groups. When a lecture is, I don't know how many minutes I've talked so far, I've talked a half an hour. There should only be 3 takeaway points. And the 3 takeaway points are, if you're overweight or obese, you have a serious problem. You're at risk for multiple diseases. You must diet. You should eat a low-calorie diet, low-fat diet, and you must exercise. The best way to do that is join a weight reduction program. It is so cheap today to join Weight Watchers. It is so cheap to join a gym. I saw the other day an advertisement, Crunch Gym. I don't belong to any gym, is only $10 a month. And I think Gold's Gym is only $20 a month. That's less than $1 a day for your health. But if you're obese, you must join a weight reduction program. And as I said, the cheapest and the best locally in Suffolk and probably in Long Island is Weight Watchers. Any questions? Are there any questions?
Are there any long-term side effects of like the weight loss shots and drugs?
Well, there are no, as far as I know, from the studies I've read on Wegovy and some of the other drugs, there were no real side effects. The only side effects were the gastrointestinal ones that I've seen. There's no black box warning. Normally, like I'm a speaker for hormonal therapy, there are black box warnings for hormone therapy because studies have shown a slight increase in breast cancer, in clots in your legs, and stroke, and coronary heart disease. But there's no black box warning on Wegovy. Any other questions? Now, if any of you have any questions, you can call me in my office and we can do a telemedicine. I'm located here at the St. Catherine's Medical Office Building, and that's about it.
Thank you, everyone, for joining us. I hope you found this interesting. We did make a recording of this program, and we will send it to all the participating libraries so that they could send it to you too.
And also, we're going to be posting this on my webpage, frankbenouramd.com, and on my Facebook page. And there's a lot of information for you ladies out there. I try to post once a month, and there's a lot of information about hormonal therapy and a lot about osteoporosis, because I'm also, besides being director of menopausal health, I'm director of the osteoporosis program. And next month, if you join us, you ladies, I'm going to talk about a problem that occurs in 80% of all women who are in America who are menopausal, and that would be vasomotor symptoms or hot flashes and night sweats. And for those ladies who are watching or who have a friend who has breast cancer, who has hot flashes or vaginal atrophy, I'm going to talk about the non-hormonal therapy for these ladies. And in America now, there are 4 million women who are breast cancer survivors, and 50% of them are on anti-estrogen drugs, and these ladies really suffer. Are there any other questions?
Hello, I have a question.
Shoot.
Um, the pills, the Eli Lilly pills, when they come out, I'm just trying to drop like 15 pounds. Is that something that I should take?
I don't, what is your weight now? Do you know?
It's about 150.
And what is your height? Let me just get my chart out. What is your height?
5'6". And it's just 15 pounds I've been trying to lose for the last 20 years.
Now, your BMI is 25. You're slightly overweight. If you were my patient, I would put you on a 12 to 1500 calorie diet and an exercise program. How old a lady are you? My
Mature.
wife said I never should ask that, but I don't see your face, so.
Mature. Um,
You
but
know,
my
when people ask me my age, you know what I say? I say I'm menopausal.
yes.
So you're menopausal. My recommendation is that you walk 30 to 40 minutes every day and you buy what I have in my office. Better get them. But no more than 3 pounds, 2 to 3 pound weights, and do 20 minutes Monday, Wednesday, Friday. 20 minutes of curls, 20 minutes of lifts, 20 minutes total. This is 15 curls, 15 lifts, 15 for the flab behind your arms. Rest 10 minutes and repeat it. We recently had, we doctors, menopausal doctors, we meet once a year. We met in Chicago last year, and 1,000 of us from all over the world. And the whole theme of the meeting is for me to tell you and your mates and your relatives, keep moving. Don't exercise in the morning. Exercise morning, afternoon, and night if you want to live a long, healthy life. It reduces your risk of heart disease, diabetes, elevated lipids in your blood, and so many types of cancer.
Thank you.
So you don't need any medication. You need diet and exercise. And you can get the Mediterranean diet right over the internet. Stay away from carbohydrates, no more than 2 to 250. Count your carbohydrates, count your calories, limit your fats and sugars.
Doctor, there is another question. Someone's asking, what about taking aromatase inhibitors that put weight on for post-breast cancer treatment?
I'm sorry.
The question is, what about taking aromatase, or I don't know,
Yeah,
ARO?
that's what I'm going to talk about next month for women who are on aromatase inhibitors. For you gentlemen or ladies out there, what that means, and 50% of breast cancer survivors are on them. And it shuts off all estrogen in your body. These ladies develop hot flashes, night sweats, joint pain. They lose bone, they develop osteoporosis, they develop vaginal dryness and painful intercourse and urinary problems. That's what I treat, and that's what I'm going to talk about next time. But losing weight, studies have shown in women who have breast cancer, who are overweight, who lose weight, who exercise, have a decreased chance of a recurrence of breast cancer. For those women who have a normal weight, who exercise and eat a healthy diet, who have breast cancer, they also have a decrease in recurrence of breast cancer if they follow a healthy diet. The one I recommend is the American Heart Diet, which is the Mediterranean diet, and exercise daily.
There is another question. How do you exercise when disabled?
Well, if you're disabled, you're entitled to physical therapy. If you're disabled that you can't walk, you can do upper body exercises. You can do abdominal exercise. And your physical, and with Medicare, if you have Medicare, you're entitled to like 20 visits of physical therapy, and they can teach you the exercises. Haven't you seen on TV? It's amazing. Men and women, wounded warriors playing in wheelchairs, playing basketball, skiing. You can exercise when you're disabled. The only people that can't exercise are people that are bedridden. That's very different.
Yes. Yes.
I think that's all the questions, unless there's any others. So I just want to thank the doctor. Thank you so much for this program.
You're very
Yeah.
welcome.
I have one more question.
Okay. Go.
According to that chart that you were referencing for BMI,
Yes.
what is the recommended weight for myself? I'm 5 foot, say 5'2". I would say I'm a medium frame and 65. What should I weigh as a woman?
How tall are you? 5'2"?
I'm like 5'2.5", whatever, around there.
I would say your BMI should be around 24. Your
Okay,
weight should be around 130. What's your weight?
oh my God, I'm way over that.
What
I'm 200.
if your weight is 200, your BMI is, let's see, is 37.
That's bad, right?
Well, let me just look at it again. Your BMI is 37. You would need to join a weight reduction program. You would need to be put on a special diet, exercise, and you would be a candidate for medication.
Okay, do you mean like metformin or
Well,
Wegovy?
metformin, I showed the slide. Look at the last slide, how much people, the slide that's up now, lost metformin in a year. Only 2% of their body weight, little over, but look how much they lost on semaglutide, on Wegovy. If you
Okay,
were
so you
my
would say
patient, yeah,
Wegovy.
yeah,
Okay.
yeah, your doctor should consider. Do you have any medical conditions?
Um, no, I mean my A1C is high normal. Um, my blood work, cholesterol is normal, blood pressure normal. Um, I don't have any heart problems or lung problems. I
Are
am a
you
breast cancer survivor 20 years ago.
well?
Um,
A good percentage of breast cancer is due to obesity because obese people make high estrogen levels.
but at that age, 20 years ago, I was not
I
obese.
mentioned even young girls have high estrogen levels and they don't ovulate. That stimulates their breasts. It has a bad effect on their ovaries. They don't ovulate. They don't become pregnant and they have menstrual abnormalities. Absolutely. I'm surprised that your doctors have not worked with you and insisted that you lose weight.
Well, when I had the breast cancer, I was only in my early 40s and I weighed about 120.
Wow.
I wasn't heavy. I had 4 children.
Uh-huh.
Um, I have gone to an endocrinologist and I did try metformin for about 2 years. It wasn't successful for me. And then in the month of, I believe it was April of 2023, I did try Wegovy for 6 weeks,
Mhm.
but there was a nationwide shortage. So I did try the point 0.5 and the 1.0 for 2 weeks each, but then they didn't have the next dosage, which would
Mhm.
have been the 1.0. So they put me on the 1.7 for
Yeah,
two
that's the
weeks,
dose now.
and it was too much for me to jump from point 0.5 to
Yeah,
1.7. So then I got all the terrible side effects.
yeah.
But maybe I should give it a try again because
Yeah,
I was
but
only
you should start off slowly. And what gym do you belong to?
well, I used to
No,
belong
no, I mean
to
now. I mean
not
now.
I mean now nothing,
Oh,
nothing. I used to belong to LA Fitness during the pandemic, but then I canceled my membership, and subsequently since then I did have two surgeries in 2022 and 2023. I had two total knee replacements. So I have done physical therapy and I'm about 21 weeks post-op. So I'm feeling good and I feel like I want to make a change. And I'm going to check into what I'm allowed to do, post-op, because I don't want to develop osteoporosis or any other disease that I don't have now, because of my weight. But thank God, like right now, all my numbers, believe it or not, are good. I have a little bit high liver enzymes. The I forgot what it was called, ASL or ALT is a little elevated, but I think if I lose weight, that should go down to normal. So oh, if I came to you, do you have a weight loss program with
I
a gym?
I recommend for you is to see someone who's interested in weight loss. I would start off with Weight Watchers. And liver problems, what men and women who are obese develop is non-alcoholic fatty livers, and that could raise your liver enzymes.
Okay. Do you have a program that includes coming to you for the medication?
No, I
And
don't have a program. I would recommend if you are my patient, because your BMI is so high, that you join a weight reduction program. And the best one, I think, locally would be Weight Watchers, where you check in every week. They weigh you, they look at your food list, and they look at your exercise.
okay. Okay.
Okey doke.
All right. Thank you very much.
You're very welcome.
Doctor, do you have contact information
For
for you?
Oh, all you have to do is Google my name, Frank Benura, MD, or just Google menopausal specialist. My name is the only one that comes up in Suffolk County.
Okay, thank you.
Yeah, but I'm local. I've been here since 1969. And I'm at the medical office building here at St. Catherine.
Okay, thanks.
And I think, well, yeah.
And you
Any
do
other questions?
consults. You do
I'm sorry?
consults, correct? You do
I'm sorry?
consults?
Yes,
Okay.
we do consults. And we do telemedicines and we treat gynecological patients
And
of
you take
all ages, not
and you
just
take Medicare.
menopausal. Pardon?
And Medicare is part of your program.
Yeah,
Okay.
I'm on Medicare. It's gotta be.
Okay. Well, that's good. Thanks. All right. This was helpful. Thank you.
You're very well. I'm sorry no men watch this.
Hmm.
Please tell your husbands or your boyfriends or whatever, or your brothers to please, if they're overweight, the same or obese, what I said for you, please let them watch the video. It'll be posted on my webpage within a week or so. Let
And
them
then
watch it.
you mentioned you were going to do one about menopausal and aromatase inhibitors. Is that another
Not only
library
that, but
program?
on hot flashes for women who are menopausal. I was a speaker for hormonal therapy for many years. Now I'm a speaker in Long Island, the gynecologist speaker for a new drug for people who can't take hormonal therapy, who have hot flashes, night sweats that affects the quality of their life. And those women who have vaginal dryness, painful intercourse, recurrent UTIs, who can't take vaginal estrogen, we have something for them that's approved by the FDA.
Okay, thank you.
You're very welcome.
All right. Thank you so much, doctor, and thank you everyone for participating in this program. Have a good day.
Okay, see you folks again. Right, bye.
Thank you.
Bye. How do we turn this off?
Thank you so much.
Thank you so much.
You're very welcome. You can